Hello, everyone. It's May the 25th. It's hard to believe. I mean, time just keeps going on. But it's for lots and lots and lots of folks, it's been a really, really tough, probably 15 months now. And we want to always start off being as respectful as we can possibly be. We've lost 13 people since the last time we were together. And, from the standpoint of progress, it's hard to say, it's hard to imagine that that's real progress, but it is from the standpoint that the number of folks that we've lost has surely decreased significantly, but 13 great West Virginians, just imagine. I mean, imagine that, and how tragic that is. But nevertheless, our 2,770th death in West Virginia is a 60-year-old female from Fayette County. Our 2,771st death is an 86-year-old female from McDowell County. Our 2,772nd death is a 74-year-old female from Gilmer County. Our 2,773rd death is a 66-year-old male from Clay County. Our 2,774th death is a 49-year-old female from Marshall County. Our 2,775th death is a 77-year-old female from Wood County. Our 2,776th death is a 60-year-old female from Cabell County. Our 2,777th death is a 74-year-old male from Wood County. Our 2,778th death is a 57-year-old female from Kanawha County. Our 2,779th death is a 70-year-old male from Fayette County. Our 2,780th death is an 88-year-old male from Morgan County. Our 2,781st death is a 72-year-old female from Nicholas County. And the 2,782nd death in West Virginia is a 61-year-old female from Lincoln County. We've read a lot of people's gender and age and the county that they reside in, and that we've lost them. 2,782 people in West Virginia. An incredible amount of wisdom, an incredible amount of just love that they've given so many. So please, don't let them become a number. Say your prayers for all these great people. Some way they'll know that you're doing that. Some way they absolutely know that they are not alone. And please, if you happen to know these families, please take time to give them a call, or absolutely, just show your love for all their loved ones. Nevertheless, I keep saying it, don't let them become a number. It's not fair. They've given us so much. We have 233 new positive cases in the last 24 hours, and our positivity rating is at 5.79. That's high because we have not tested a lot of people in the last 24 hours. Our cumulative percent positive is down to 5.11. It continues to slowly drop. Our active cases are 5,341. That's down a goodly little bit, and that's good. We have 152,464 people that have now recovered from this dreaded killer. We have 232 that are hospitalized and 85 that are in the ICU units. Even though we have no red counties, just envision, we have 232 people that are in the hospital right now with this absolute terrible killer. But in addition to that, we've got 85 people, I guess inclusive of that, we've got 85 people in our ICU units. Those people are struggling for life right now. I've got to remind you, and I've got to ask you just this. Of the 2,782 folks that we've lost, First and foremost, envision just this. You know, would there have been any of them that if they had the choice again right now that they wouldn't have, if they could have, many of them we lost way before we ever had a vaccine. Now we've got 232 people that are hospitalized and 85 of them are in the ICU units, and we know the overwhelming majority of those folks, if not every single one, is not vaccinated. I don't know what to tell you. I don't know what to do and what to tell you any more than just the fact that the vaccines are so safe, it's unbelievable. The vaccines are incredibly effective. And it has truly been a miracle from God above that we were able to have a vaccine as soon as we did, and the effectiveness come out as strong as it came out. And the safety of it as high as the safety is. I know in my heart, I know of the 232 folks that are hospitalized today that are still alive, are still breathing today, how many of them would rush to take the vaccine? And it's probably a big amount. So why not do it? Why not do it before you're one of those? I just can't understand it, and all I can do is continue to ask you, you know, and continue to tell you just how important it really is. Another reminder, if you're 65 and older and you get the least bit of sickness in any way, tired, anxiety, a little cold, you think it's that, please go get tested. And these antibodies can absolutely save your life. Vaccine eligibility is 12 and up right now. You know, from the standpoint of our young people that are 16 to 35, I've asked all of our parents, grandparents, everybody to encourage those people, encourage that group to really go and get vaccinated, because they are spreading this and everything. They're going to continue to spread this. There is a real possibility that they could come up with lifelong side effects from this, you know, from the standpoint of heart or whatever it may be, you know, but by their spread, you know, we continue to lose people, and we're going to continue to do that until we get more and more people vaccinated. From the standpoint of our savings bonds and gift cards, that registration is open right now, and for all 16 to 35-year-olds and everything, you know, to be able to get your savings bond or gift card, you just got to go to our website and go through and get that, and then we'll get that out to you really soon. It's all right there on the screen. Okay, from the vaccine distribution update, we're at 84.9%. We've got, you know, get this number. We have got 82.9% of all 65-year-olds and older that have at least one dose. Goal is now 85%. We're going to get there. We're going to get there. You know, it may take us a little longer, but we're going to get there. And the goal on the 50 to 65-year-olds was 75%. We're going to get there on that. But the one we're going to get there on, and everybody just says, oh, no, we won't get there. You just wait and see. The one that is the 65-year, I'm sorry, the one that is that we're trying to get to is 65% of now all the eligible folks that are in our state. So that means anybody age 12 and older. And now that number the other day I think was at 55.9. Now that number's at 57% that have received at least one dose. 46.4%, you know, are fully vaccinated. But what we're interested in achieving by June the 20th is to get as close as we possibly can. You know, we may be at, you know, 63.8 or 64.9 or whatever, but but we're going to get as close as we possibly can to 65% of all of our eligible population to have had at least one dose. We're at 57 right now. We've got 8% to go. So come on, just help me just a little bit and we'll get there. From the standpoint of this, I go back to a time in January, a time where we had people dying like flies, and it was really bad. A time in January when our elderly were really, really scared, and rightfully so. A time when we were told by the CDC that the only way that we're going to be able to get to the general population was going to be a goodly amount of time. Because the amount of vaccine that we had was not anything close to like what it is today. And so as the vaccines were just rolling out at that time, that's exactly what was happening. You had all of our folks that were 65 and older, especially, the most elderly, and they were scared to death. They absolutely were scared to death. Every day they heard me read big numbers of people that were dying. And so they were told by the CDC that we were maybe going to get to you in April. Well, a lot of them would have died before April, and they know that. And so what did we do? West Virginia, through our medical experts and good decisions along the way, we pivoted and we changed the whole landscape. And we immediately went to those that were 80 and older, and then 70 and older, 65 and older, and everything, and started vaccinating them. Now today, we have 82.9% of that population, 65 and older. For all practical purposes, 83% of the 65 and older are vaccinated, or at least have one shot. Now just think about this. I don't know exactly what that number is right now, but that number's got to be well over 200,000. Well over 200,000. Now we moved and we made decisions. And along the way, everywhere I go, I run into countless people that are 65 and 80 and 85 and even older. And they come up to me and they say the same story, the same thing. You, Governor, your team, Governor, stepped up and got me my shots. And now, Governor, no telling how many folks just like me we saved. Well, I'm telling you, this job can't get any more fulfilling than just that. So for all those people that are out there, I, along with all the team that made decisions to try to shove these vaccines out the door and get them in arms and everything, I am so grateful to you because of all the wisdom and all the great stuff you continue to give us. And remember, we called it saving our wisdom, and we did. We saved a bunch of our wisdom. We've still lost a lot of folks, and we want you and everybody to always join in prayer and everything for all the folks that we lost. From the standpoint of manufacturing and our church outreach and our business outreach, we continue to do the same thing. Whether it be your congregation or your employees and everything, we want to vaccinate them. All you got to do is call us. Our state park vaccinations, all those clinics and everything going on and everything. And over Memorial Day, we'll be in all the West Virginia state parks to be able to vaccinate the employees' families, all the park guests, anybody that wants to be vaccinated will be there to be able to do it. And we're there in lots of the parks right now. Okay, our COVID vaccine info line is up. You've got all that. Our call to arms, initiative and everything that we're targeting. Our birthday, June the 20th, our 158th birthday in West Virginia, and to be able to get rid of the mask and everything. And so we're moving in a really, really, really positive pace there. And I know I've seen some of the media reports, and it's just, I have no earthly idea why we continue to try to just stir in something that's just, it's only just to cast doubt and everything else. We're through with these masks on June 20th. We're through right now with the mask if you've been fully vaccinated, But with all that being said, we're on track, and you just wait and see. The numbers will prove me right on this one, and at the end of the day, we're going to get rid of these masks on June the 20th, period. So, nevertheless, all the free testing stuff is up. The free testing map is there. I thank Fruth and I thank Walgreens over and over. I tell you to take advantage of the free testing. It's not long ago. Now imagine this. Do you remember when just not long ago at all, that we were scrambling like crazy and we had test kits, and we had those kits, and then we had to send the kit off, and it took maybe a week to get some kind of result from a test kit, and we had such a small amount. It was unbelievable. Just a very handful of test kits in the beginning. Now we've got all the testing available and everything, and so imagine how much you would have loved to have had the ability, or you did, how you yearned beyond belief to get tested. And then I kept saying over and over and over, the more we test, the more we learn. And it's true. It's true. All across this great nation, we learned, and we learned more and more and more. So please continue to take advantage of that free testing when you can. Get this is a great number. We were down significantly. I don't know if it was 17 or 19, but we had 17 or 19 outbreaks in our long-term care facilities. Now we're down to 10. That's really good. We had significantly more outbreaks in our churches. Now we're down to 6, and we're down to only 4 counties, and that is Greenbrier, Hardy, Taylor, and Wetzel counties. In addition to that, at corrections, we surely have had inmate cases that have been very significant. Now we have 2, and we have 7 staff cases. It's all great stuff. And I congratulate the church community, our long-term care folks, all the great work that's happened at corrections and everything. And so please keep it up. We can't drop our guard. Please keep it up. I ask all those of you, especially that have survived this terrible killer and everything, to go give blood. Go give blood. Now, I've got to give you an update on this, and I want especially our elderly to pay really close attention to me. There's a vaccine lottery scam going on. The FBI is warning us about a new scam targeting those that have been vaccinated. And what's going on is just this. There's people that are calling, and they call on the phone and they say, have you been vaccinated? And if you have, then they turn and they tell you about this great thing that you can enroll in, and maybe you can win all these great prizes or whatever it may be that are tied some way, somehow to the lottery. That's all absolutely a scam. And all they're trying to do is get your information. So without any question, until you hear it here, until you see stuff on our website and everything else, do not give people information. Because once they get that information, they're going to try to invade you and absolutely extract things from you. You cannot give them that information. It's nothing but a scam. That's all I've got. That's all I've got. Again, keep all those in your prayers that we've lost. Thank you so much.
All right. Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. To reinforce what the governor said, we are seeing cases of COVID-19, new cases, drop steadily across our country and also in the state of West Virginia, which is certainly good news. We are down on the 7-day average to the lowest level that we've been as a country since mid-June. And several new developments have been identified. Number one, is that the Moderna vaccine appears to be safe, just like the Pfizer vaccine for 12 to 15-year-olds. And so we anticipate that that will be the second vaccine that will go in front of the Food and Drug Administration and the Centers for Disease Control to look at being available to immunize younger West Virginians. We also know that a recent study that was done at the CDC looking at small children that are less than the age to vaccinate, which is now 12 and over, have been found to rarely get serious disease complications from COVID-19. And that doesn't mean that we should be cavalier about our protection of our children. But the good news is for parents in looking at the data from COVID-19 that your young children, even if they would become infected, are very unlikely to get serious disease per the CDC study. And as we continue to go forward, our anticipation is that vaccine manufacturers will continue to push the age down in their clinical trials so that eventually we should be able to get to almost all West Virginians and almost all Americans with vaccines. But again, currently the vaccines are only available for 12 and over. And lastly, as the governor said, we have done very, very well as a state, and we're really proud of our citizens and certainly appreciate the work of so many people that have worked very hard to get vaccines into the arms of our citizens. And we see the great benefit of that. The CDC quoted 4 research studies that demonstrated that these vaccines are very, very effective and very safe. And that's the reason why they felt safe. Dr. Rochelle Walensky, who leads the CDC, and her team felt safe in recommending that fully vaccinated people 2 weeks after the final vaccine dose were safe to take their masks off indoors and outdoors. And I think that this call to arms, as the governor said, that we are very much focused on in the state of West Virginia is a very important program, not only to get us back, as the governor is doing, back to all the things that we enjoy to do together in person, but also to be able to do that safely. And while we still have a number of West Virginians that haven't been vaccinated, those people are still at risk for developing complications, both severe and perhaps long-term of COVID-19, which the vaccines appear to protect against incredibly well. So we continue to encourage all West Virginians who are vaccine eligible to please choose to be vaccinated. It is so important to protect yourself, to get back to the life that you want to live with all the people that you love safely. And by doing that, you also protect others. Thank you so much.
Thank you, Dr. Marsh. We'll next go to Dr. Ayn Amjad, our State Health Officer.
Good morning. I just wanted to let everyone know that our Office of Vital Registration is open to the public now. It's open Monday through Fridays from 8:30 to 5 p.m. Unvaccinated individuals are recommended to wear masks. Socially distancing is recommended also inside the building. The payments accepted are cash, money orders, and checks. If you are going to pay by cash, we do recommend that you bring exact change, please. But we do have those the building open now to individuals, and if you are going to bring exact change, it is $12 for your certificates. But we are open, and we appreciate your patience during this time. Thank you.
Thank you, Dr. Amjad. Retired Major General Jim Hoyer, the director of our Joint Interagency Task Force, and Secretary Bill Krause with the DHHR are also joining us today and are available for questions. We'll now go to questions from members of the media. Our first question today is from Stephen Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. Obviously, it's early yet, but do we have any numbers so far on the number of people who have filled out the registration to get either a gift card or a savings bond? Do we have an idea of what that number is so far? Thank you.
Stephen, it's just starting. I think we've gotten like 18,000 or something like that over the last couple of days, but that's just very, very, very minuscule to the total that we're going to get. I don't know exactly what that number is where that number is going to land, but I'd say we're going to race past 150,000, and so but I right now I think we've gotten about 18,000.
Thanks, Stephen. Next, we'll go to Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members. Let me give a quick shout out to the St. Albans Regional Vaccination Clinic to be held Friday, July 4th. The first 300 people to get their shots in St. Albans, you don't have to even live in St. Albans. You could live in Hurricane or Campbell's Creek. They'll get a $20 gift card for use at a St. Albans business as an incentive. So First Presbyterian Church in the city are glad to do that. Anyway, my question is this. Governor, where are you now on this plan to try to attract people back to work? You put forth an idea last week that maybe the state would pay $500 and then a private business would pay $500. I talked to some businesses that gave some pushback. They said, we just don't have that kind of money sitting on the table right now, especially restaurants. Their margins are thin. So where we are with that incentive plan and how soon it can be implemented?
Mark, we're really close, but let me go back just 1 second and say just this. First of all, I really, really appreciate you, giving that shout out to the St. Albans people, and the clinic that they're going to be doing down there and everything. And I can remember just like it was yesterday, you talking about, big guys and as we get a little older, we have issues in life and everything. You were talking about, some of the issues that you have health-wise and how anxious you were to get your vaccine. And so I would just remind everybody, of your story and all the stories that are out there, especially, from the standpoint of if you happen to be a 16 to 35-year-old, you got to know that you could very well have this and not even know it, but be transmitting it like crazy and everything. And absolutely for folks, like Mark or myself or anyone, it could end up tragic, and it could end up tragic for you with long-term side effects and everything. So please, 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 take heed to what Mark is saying and everything. He's a patriot in many ways, and so I appreciate Mark, all the good words about the St. Albans folks and their clinic. Now, from the standpoint of the, we continue to work with the legislative leadership in regard to this, but I do think, Mark, now my position is going to be just this. I don't see any reason to put any additional pain on our small businesses at all. We need to encourage people to get back to work, and what I'm trying to do now is just balance how much dollars are available from the state that we can do that, coming as an incentive right from our state, and not lay any additional burden whatsoever on our small businesses, because you're exactly right. I mean, we've got folks that would gladly step up and pay the $500 match. I mean, they'd do it in a second. But we got a lot of other folks that just can't afford to do it. And, really and truly, it just makes it really, really tough on them. So what I'm looking at now is just doing it purely just from the state. It may only be the 500, and that may be all we do. But I'll assure you that at the next briefing, that we'll have that concluded and we'll be in the pipeline ready to go.
Thank you, Mark. Our next question will be from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, last week you mentioned that you were working on plans with legislative leaders for the most recent tranche of federal funding. Is there any update or new info you can give us on that? Thank you.
Charles, I think it's a little premature on that. We have started the process and everything, and we want to do what we've done in the past. I mean, here's the whole thing. If you go back, and I'm not, just blowing our horn and everything, but if you go back to the original CARES dollars, the $1.25 billion that the state of West Virginia got, it's all the money in the world and everything. And what did we do? we were really prudent about what we did. We just didn't rush out and push out $600 million to the counties and the cities, but we ended up at the end of the day, fulfilling all their requests and absolutely backfilling all their needs beyond belief. And we pushed out, I don't know, 280 million or some number. I think that's the right number. And then we absolutely held dollars back for workers' comp so that we wouldn't have to go and jack up, workers' comp premiums and so on like that on our businesses and just devastate our businesses. And we just kept doing and doing and doing as we moved along. And everyone kept saying, what are we doing here and what are we doing there and everything. But at the end of the day, I haven't heard a single complaint I have for a long, long time about how we handled all the CARES money, and we did it right. You know that exactly. And we've continued to meet with all the county and the city folks and everything. We're going to continue to talk about maximizing these federal dollars all across West Virginia and everything and doing it right. But we could just frivolously throw money at this and throw money at this, and you know what then's going to happen? As sure as I'm sitting here, we're going to turn around and say, we got real needs over here, but all the money's gone. And we don't want to have that happen at all, So we're just going to try to continue to do it right, and we're going to continue to meet with the legislature and the city and the county folks and everybody, and we're going to get this done, and we're going to get it done right. But I think it's a little premature right now to say exactly, what we're going to do where and different things, because we haven't gotten to that yet.
Thanks, Charles. Our next question will be from Paul Mullen with WCBC.
Good morning, Governor. Good morning, everybody. Governor, concerning the testing program, are you having consideration or discussions about rolling that back a little bit now that the vaccination rate is going up? How long can you keep going at the rate you've been going and keeping that availability as it is? Thank you.
Paul, I've really not considered, rolling it back. And the reason I've not considered that is the DHHR has their own federal funding, and I think it is still critically important that people can get, Paul, just think if we were just to really cut back on our testing today, in all honesty, you'd have a lot of people that would be so inconvenienced if they had to go a long ways or whatever it may be to be able to get a free test and everything, that would just say, I'm not going to do it. I'm not going to do it. And before you know it, then we've got a real problem, because you've got a bunch of people that are really sick that don't even know it. The antibodies are out of the window to be able to help, and you got a lot more people dying. And so, Paul, I think monetarily, I think we're in good, sound shape with DHHR and the federal funding that they have there. And right now, I don't have any plans to back it off, and now there'll be a point in time, but not right now.
Thanks, Paul. Our next question will be from David Beard with the Dominion Post.
Hi. I have a two-part question on a single theme. So part one is today WVU updated its mask guidance for the fully vaccinated. And I was wondering how that applies to Ruby, which is a teaching hospital, and to the other WVU medicine hospitals and clinics. And then part two is how are hospitals and medical facilities across the state responding to the updated mask guidance, and what are they discussing and planning come June 20th? Thanks.
Hey, David, how you doing today? I hope everything's good on your end. But Clay, you got to answer this, please, sir.
Sure. Thank you, Governor, and thank you, David. David, as you, I'm sure, know that from the Centers for Disease Control guidance, that the exception to having masks off in public are related to a few different types of environments. One is healthcare facilities and clinics, including hospitals. Another is congregate settings like nursing homes, long-term care facilities, or prisons, correctional facilities. And the third is in federal transport, like airlines and other transport mechanisms, trains, et cetera, that are overseen by federal sources. Those are all exempted from the CDC's recommendations. So through the WVU medicine system and through the other hospital systems, as well as the clinic systems, we anticipate that masks will still be required in those environments to make sure that we are protecting vulnerable people who are being seen in those types of facilities. If and when we may approach the levels of herd immunity, where we have an overwhelming majority of our population, entire population vaccinated, those recommendations and guidances could change. But currently, the guidance is very clear when it comes to healthcare facilities like hospitals and clinics where masks still should be worn. Thanks.
Thank you, David. Our next question will be from Bob Aaron with WCHS and Fox 11.
This will probably have to go to the health folks, I would guess, but have there been any complications from the second shot, these rare instances that they've talked about nationally, where people have had some problems, some younger people have 4 days after the second shot? They've been extremely rare. I realize that's something way better than the odds of being hit by lightning, but have we seen anything like that here? And as an aside to that, we sort of work out the logistics of getting vaccines out ahead of the rest of the country. Why do you think we're falling behind them so much in getting people inoculated?
Okay, let me take the back end of the question, and I want to comment just 1 second on the front end too. Bob, I appreciate your statement, about from the standpoint of just this. I mean, and just think about this, especially young people. Think about this. The comment was the percentage of probability of you having any issue with this is significantly less than getting struck by lightning. Now, I mean, I don't know how we could ask for anything better in life than just that. I mean, quit listening to these crazy people that are absolutely portraying things like your skin's going to catch on fire, you're going to grow antlers, you're absolutely not going to be able to see again, whatever it may be. Please quit listening to that garbage. It is nothing but garbage. That's all there is to it. And so, because the vaccines are phenomenally safe. Now, Paul, Bob, the back end of your question, and I'm going to defer to Dr. Amjad because she's the medical folks or Dr. Marsh. But Bob, the back end of your question said, why are we continuing to struggle right now with getting shots in arms? And the answer is just plain simple. We charged forward. We were the first out of the blocks and running forward and everything. And we got an incredible amount of our folks vaccinated. And then, just like other states are doing behind us, then everybody that was behind us is at some point in time going to hit the wall. And so, we're still continuing to come up with, any and every way we can to get more and more folks across the finish line. But that's the whole reason. We were just out of the blocks really fast, and everybody, every single state, everybody has got a wall. We just were faster getting to the wall than most all the other states. But Dr. Amjad, if you could go back to the first part of the question, and maybe Dr. Marsh, you could back it up if need be.
Yes, Governor. Bob, I'll answer some of it and let Clay answer some. But so there has been reports in the media of some young people having myocarditis, and I'm not sure if that's what you're referring to after getting Moderna or the Pfizer vaccine. So far to date, we have not seen any in West Virginia. If something like that were to happen, we would likely get a call from one of our, health department agencies or one of our hotline calls, because that is something that we would want to know about. So that would probably most likely be on mine or Clay's radar right away, because those get reported right away to our state hotline calls. But those are things that we would be concerned about. So they are very rare, as the governor stated. The vaccines are very safe, but things like that do get reported in the media because they are very important for people to know. But those things are very rare. But I'll see if Clay has anything else to add for that.
The only other thing I would say, and thank you, and I think you covered it well, is that the CDC is just looking at some very, very rare reported cases through their systems. And what they are finding so far, at least as far as we know, is that it looks like that the rate of any type of inflammation related to the heart, called myocarditis, as Dr. Amjad said, is no greater than the rate that we see in the normal population. It just is being seen in some of our young people who have gotten vaccinated. And so at least at this point, it looks likely that this is just a normal occurrence in a group of people that are also being vaccinated versus a cause-effect issue. The one part that we will pay a lot of attention to, though, is any related effect in anybody vaccinated, like we talked about in the women who very rarely had blood clots after being immunized with COVID vaccines, particularly the Johnson & Johnson. So we pay attention to all these. And I think it just should reassure people that our federal agencies, CDC, and our state agencies, as Dr. Amjad said, are paying critically close attention to anything that may come up in people that are being vaccinated. But this one most likely is going to be a background effect of a common occurrence or an uncommon occurrence happening in people who also receive vaccination.
Thank you, Bob. Our next question will be from June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. My question is not COVID related, and it is for Dr. Amjad. So I understand that the CDC will be providing an EpiAid to Kanawha County to address the HIV outbreak. And I'm just wondering, could you tell us a little bit more about what all that will entail, what comes with an EpiAid for this situation, and how much do you think it will help?
Dr. Amjad, you, please.
Sure, June. Yes, so the EpiAid was requested by our state epidemiologist to the CDC on May 17. So the EpiAid will add additional forces to our ongoing efforts for the HIV outbreak in Kanawha County. And what they will do is assist with testing efforts there, also with any additional follow-up with the HIV outbreak that's ongoing down there. So we already have, Dr. Sherry Young and Dr. Angie Settle, who's doing needs assessments down there. So it will add forces that's already ongoing out there, but rapid testing on site locations that will be happening down there. So we're not sure how many people they may send. We have to wait, but I think they'll be coming down maybe in a week or two, hopefully. But they just add additional forces that we need for increased testing capacity, follow-up through with care, continuity of care, and that kind of assessment. But that's what we're hoping to see, just increase our capacity of investigations. Thanks.
All right, thank you, June. Governor Justice, back to you to close it out.
Okay, everybody. I don't have a whole lot. I just want to thank again the folks in St. Albans areas and and the businesses that have stepped up and everything and going to give that $20 gift certificate or whatever to anyone that comes in and gets vaccinated. That's that's just a perfect example of what I've said all along about how we all pulled the rope together. That's one thing we've done, in West Virginia, and that's absolutely been the key to making all this work we didn't ever get fragmented. You know, we had all kinds of different ideas and everything, but along the way we stayed together, did we not? And we helped one another. You know, there's something really powerful about loving your neighbor. It's beyond powerful, to tell you the truth. And so we've done it, and we've done it and done it and done it. And so I congratulate and thank all those businesses in the St. Albans area, you know, for stepping up and all the other stuff that so many are doing all across our state. But that's really great. Now, the only other thing I'll give you an answer about the incentive from the standpoint of getting our folks that have been out of work and everything, and getting them to step up and getting them back on a job, because we need them. We need them really badly. And for those people that are doing that, they probably need a little bit of an extra little bump, you know, because they're going to be losing some of their unemployment benefits and so on, you know, the bonus money. And so with all that and everything, we want to give them a little bump and everything, get them back in the workforce and get them back, you know, to feeling good, and especially from the standpoint of getting them back in our businesses, you know, being able to staff their businesses properly, and going forward, you know, we hope and pray that we'll do the things that will make more and more people want to come to West Virginia, and as we do that, we'll grow our employment rosters in many ways. The only other thing I've got to report is just this, is I want to revisit, I made myself another note here. I want to revisit with our team. You know, it seems a crying shame. I mean, does it not? It seems a crying shame that you've got to come up with new incentive ways to motivate and get more and more and more folks to be able to come out and get tested. But now let's just be fair. You know, if we've got dollars that are there that we can do that with, and we're able to do that, and get people tested. I don't mean tested. I mean get people vaccinated. If we can get our folks vaccinated, can you imagine what we're going to save? You know, not only will we save life, and we will save incredible sickness and all those kind of things. We know we're going to save that. But the other thing we will save is the magnitude of this testing cost, and on and on and on. It will be off the charts as to what we can save in dollars. So when it looks like, you know, well, good gosh, you know, why in the world are they doing these things, these incentive things, or why are other states doing all these, you know, elaborate things? You know, just, I hate to say it, but it's just what it is. We shouldn't have to do it, but at the same time, you know, it does get us there. And if we get there, the earlier we get there, the more we save. And so I'm going to revisit with my team again. You know, we've got a lot of suggestions that were fun type things and everything, and where people could really pick up some neat things, whether they be, you know, some kind of prizes or they be real cash. And so with all that and everything, we're going to have to revisit one more time. And when I come to you the next time, I'm going to probably come to you with a new incentive program that's going to try to take us one more notch further. And that's the only way I know for us to get there right now. But nevertheless, we're just going to keep at it. Again, thank you so much. Let's stay together. You've done a great job, West Virginia.